Welcome to this Tutor to You sociology topic video on sociological approaches to health, focusing on feminism. As a conflict theory, feminism focuses on the inequalities in the healthcare system and how women are disadvantaged by medical professionals, how the healthcare system is patriarchal, and how women's health inequalities have become normalised in society. Feminists take a holistic view of healthcare, examining the medicalisation of women's health, including natural events such as childbirth and pregnancy. Furthermore, they examine how medical professionals use such events to monitor women, ensuring that they are complying with advice and acting as a good mother. Feminists also tackle inequalities in employment practices, citing the patriarchal construction of the healthcare system and its attempts to alienate female doctors, whilst also examining the ways in which decisions regarding the female body are dominated by male decision-making. One of the most prominent feminists writing about health is Oakley. She suggests that childbirth and pregnancy have become medicalised over the past century and cites the increased monitoring of women before, after and during pregnancy as evidence of the growing reliance upon the biomedical model for women's health. In the 1970s, Oakley conducted interviews with mothers and accompanied them on their journey throughout their pregnancy, even being present at the birth of some of their children, which links into feminist methodologies that were developed by Oakley. In interviews conducted after the birth with women who suffered from postnatal depression, Oakley found that medical professions saw this as a deficit model of femininity, seeing women as broken in some way if they were unable to cope with the multiple demands of rapid physical, emotional, and social changes to their lives. Rather than offering assistance or reassurance, these women were perceived to be abnormal and were treated as if having an illness rather than being treated with compassion, according to Oakley, who stated that the symptoms of postnatal depression in the women she interviewed were of exhaustion and being overwhelmed, rather than any form of illness. Support for Oakley comes from Jebali, who found that women with postnatal depression were viewed as deviating from the idealised notion of motherhood as being a time of wonder, love and positivity. Jebali, like Oakley, suggested that women who were suffering from postnatal depression, particularly those who had experienced traumatic births, were seen as lacking in some way and medicated. The stigma attached to feeling unsure and unable to bond with their children following birth was stigmatised as being an illness. While society idealised motherhood, little support was offered and little status afforded to women who gave birth, and this creates damaging psychological impacts on women. Jebali found that women were expected to just adapt to the changes of motherhood, with assumptions made that motherhood is natural for women, with little recognition of the seismic changes that motherhood brings. A further argument put forward by feminists concerns the increased monitoring of women's health by medical professionals, not only their own health, but those of their children. Midwives, health visitors, and other medical professionals view women as solely responsible for the development of children, and so monitoring children's development is a form of monitoring a woman's suitability to have children. Douglas and Michaels highlighted the increased scrutiny of women's lifestyles, their involvement with their children's development, and the physical characteristics of their children by medical professionals and others to ensure that women are conforming to the expectations of society, something that is not repeated with fathers or those without children. Finally, feminists suggest that healthcare systems are patriarchal in nature, and that despite recent developments, males remain in power in most healthcare settings. Witt highlights the history of excluding women from both general and specialised practices in healthcare, consigning women to the role of nurse rather than doctor. Furthermore, male doctors are given power to control women, particularly with regards to mental health. Women are more likely to be treated with antidepressant medications rather than dealing with the issues that cause mental health issues. In recent years, however, there have been changes. Increased numbers of female medical students, around 57% in 2019 being female, and the majority of general practitioners in the UK now being female brings some change. However, higher positions such as registrars are still dominated by males. In evaluating feminist approaches to the medicalisation of childbirth, it's worth examining the increased age of first births in women, which has increased significantly over the last 50 years. As women become older, risks associated with pregnancy become greater. However, many feminists would counter this and suggest that pregnancies of women in their 40s were commonplace in the period before World War II and the creation of the NHS. The patriarchal structure of health may also be criticised by looking at the percentage of female workers in the NHS. 77% of NHS workers were female in 2018, although, as we have already suggested, this is not reflected in higher positions. Finally, the medicalisation of female healthcare and the use of the biomedical model can be criticised by analysing the impacts of social determinants of health. Housing and income are important factors when looking at health, and women are overrepresented when it comes to low incomes and inadequate housing, which suggests that medicalising women's health is a smokescreen to cover wider social issues. That concludes this Tutor to You Sociology topic video on feminism and health. Thanks for watching.